Welcome everyone to our first episode of OptiMind X podcast. This show is all about connecting with entrepreneurs and innovators, hearing their stories and exploring how businesses and technology are evolving in today's fast-changing world, especially with the rise of AI. Today, we're honored to be joined by Dr. Yuli K. Chettipally, an award-winning physician, researcher, and entrepreneur with more than 20 years of experience in emergency medicine, clinical decision support, and digital therapeutics.
He's the founder of Sirica Therapeutics and a groundbreaking startup developing a novel therapy system for children and autism using robotics, virtual reality, and video gaming. His mission is simple but powerful: to make the therapy fun and effective for children and families.
So, Dr. Yuli, it is also the founder of and president of Innovator MD, the world's largest physician innovative platform, which informs, inspires, and ignites solutions to revolutionize patient care. Through Innovator MD, he organizes events, classes, accelerators for physician innovators and startups, helping them bring life-changing healthcare solutions to the market. He is also the author and publisher of The Machine, The Promise of Artificial Intelligence in Healthcare, a thought leader serving on multiple boards and a recipient of prestigious awards for his work in innovation and research. Dr. Yuli, thank you for joining us. It is an honor to have you here on the podcast OptiMind X.
Having me, Melanie, and Jorge, it's a pleasure.
Dr. Yuli, thank you for being here today again. And we want to go ahead and hit it off right off the back. I know you've been leading both Sirica Therapeutics and Innovator MD. How has life been balancing so many exciting projects?
Well, when you're passionate about something and when your life mission is bringing innovation to life, well, it is a lot of fun. Of course, keeps me busy, keeps me active, and also brings me in touch with some of the smartest minds in healthcare today and technology, of course. But it's very exciting. It's hard juggling a lot of things, but when you're passionate about something, it is more enjoyable than it is work.
Right.
Right. So in that note, what inspired your journey from emergency medicine into innovation, research, and entrepreneurship?
Yeah. So when I was working, I was working at a large healthcare system, and when electronic health records were introduced to the health system, I see that a lot of people see that as a challenge and a pain. Of course, it was a very painful transition to digital, health. But one of the biggest, these challenges also come with opportunities. One of the big opportunity I saw was that all this data is being collected on patients, and how can we use that to make healthcare better, to make patient outcomes better? That was my focus while I was there at this organization. And that's why I worked on a platform, a technology platform that we built to take data from electronic health records and be able to provide predictive analytics to the physicians while they're seeing patients. And when you do that, what happens is the decisions that physicians make are much better for the patient outcomes and for the physicians themselves, because they have the full support of technology to help them make the right decisions. And so that was my eye-opening experience. And then I realized that physicians are the key to make patient care better. And so I started looking into this space. I started a group in the Bay Area to look at how are physicians doing innovation. What I realized is that there's a big gap for physicians and other healthcare people, nurses, pharmacists. They are not part of the innovation cycle. They are not participating in innovation, mainly because either they don't have the time, they don't have the knowledge. It's not like they're not seeing problems. It's not like they're not coming up with solutions, but they are doing all this. They see the problems firsthand. They come up with solutions, but that solution may not see the light of day because it needs a lot of support. Innovation needs a lot of support. And so that's why I built the community Innovator MD, to be able to provide that knowledge, skills, connections, and hopefully funding to be able to bring that to market.
Okay.
That's so exciting. And it's really nice to hear how you facilitated and filled the gap, because like you're saying, it's not that some people don't want to fill the gap, is that I really, really love what you said about that innovation needs support. And so creating
Yes.
that resource. In that regard, how does that transfer into Sirica TX? How did you transition from Innovator MD into Sirica TX? Where was the mission born to make therapy more effective as well as engaging for children with autism? We'd love to hear your story and how that was.
Sure. So when I was, at Innovator MD, I was interacting with many companies, 100, 200 companies a year. These are all startups and, coming up with unique ideas. So what I would do is I would pick 30 or 40 of them to come present at our meetings, at Innovator MD meetings. So we do conferences, meetups, startup showcases. And out of those companies, I would pick one or two companies to work with closely, either as a part-time chief medical officer or as an advisor, sometimes as an investor, as an angels investor. I would mentor these startups, and as they grew, I started realizing that this is the best way to bring innovation to market. But in that process, I also met with some companies, especially this one company that was making a therapeutic device for stroke rehabilitation. And when I saw that, I jumped at the opportunity. I joined them as a chief medical officer and an investor, and I helped them develop, this device. And when I saw the results in patients in our early studies, I was very surprised at the positive results that came out of that. That's when I said, okay, this can work for autism. I have a daughter with autism, and she's an adult now, but learning from her life and how she progressed and how she improved, she has an amazing story. That'll be a totally different podcast that I could do a whole hour of. Basically, what she did was that exercise was a big part of her improvement process. And so I took her to this company and had her try the machine, and she loved it. And the machine is fascinating because it is a robotic device, which means it looks like an exercise machine, but it's actually a robotic device. And it tracks all the movements that the person is making on the machine. It looks like a recumbent bicycle, basically. But it has all these connections where when you put on VR goggles, and then it connects you to a video game, and you become a character inside the video game where you're riding a vehicle while you're riding this machine. So whatever you do on the machine will be replicated in the game. And whatever happens in the game, you actually feel it in the machine. So all the ups and downs, all the twists and turns, you see you feel the bumps in the road, the wind blows on your face if you're going fast, and you can smell the surroundings, and you can hear, the environment through the headphones. And so basically what we are doing is we are taking people into deep immersion where they are in this artificial world, and then they are challenged with the physical activity, which means they have to ride this vehicle, and a mental activity, which is playing the game itself. And when you do that in a deeply immersive environment, you are challenging the brain, and you're also creating an environment for neuroplasticity. Neuroplasticity is where new nerve connections happen in the brain. And when new nerve connections happen, they usually plug these gaps, whatever deficits that person may have, and you can see improvement in their symptoms, in their deficits. And that is a very new way of thinking neurorehabilitation. And that's what I want to apply to autism. And so we got a license from this company, and we took that technology, and now we want to bring it into autism world. So right now we are raising our first round of money to be able to do that, to be able to set up a clinic, a machine, bring it to the San Francisco Bay Area, and have people try out the machine and do some clinical studies on that with patients with autism or individuals with autism. That's the plan.
That's very exciting. And I want to ask, that being said, is this connected to Sirica? I believe your daughter's name is Siri? Siri?
Yeah, that's
Yes.
right. Her name is Siri. And this was, by the way, this was before Apple stole her name.
Yeah,
The innovative.
you definitely have the ownership. You have the patented name.
Definitely. And is this connected to Sirica AI? Is this also an extension of?
Yeah, Sirica AI is interesting. Actually, we released that Sirica AI, the first app, last weekend at a conference.
Congratulations.
That's awesome.
Yeah, thank you. At a conference in Monterey area. The idea behind, okay, so now I have to add in Siri's story. Siri, I would say she has moderate level of autism. Now, when I say Siri, my phone is getting activated here. So let me switch it off.
I didn't get that. Could you try again?
There it is.
So Siri's story is that she's our firstborn, and when she was 3, she was diagnosed with autism because we were not seeing the milestones, mainly communication. She was not speaking, and then she had some behaviors that are typical of autism. So in those days, they would wait until the child turned 3 before they would diagnose. But within a few weeks, few months, I knew something was different about her. Something was wrong. And so throughout her school life, she was placed in a special ed class, which is, they don't expect you to do too much. They can't teach you much, but, you're just there spending time. Sometimes it was very frustrating for her, and she would go into these behaviors where some of them were aggressive behaviors. And so the teachers were very frustrated. And as she went through her teenage years, it was very difficult. And we had to place her on medication, which did not have a good effect on her at all. She started gaining weight, all the side effects, and it was miserable. So the first big, I would say, leap she made was when we decided to place her in an exercise program. And this is a very intensive exercise program. It's not just your typical. This involves aerobics, weightlifting, boxing, pretty intensive, and several days a week. Initially, it was very hard for her, but then after a few weeks, she started loving it. And she started loving it so much that she would want to go there to the gym. And we had, special trainers and all that. But also, her behaviors changed. Her behaviors, she calmed down a lot. Her appetite came down a lot. And so she was eating less, and she lost about 30 pounds on that program. And we were able to wean her off of medication. And so that was a success story.
Absolutely. That's a huge success story. That's a very being able to wean off of and see such a complete shift just from physical activity, I think goes to show the power of activity and the body, and connecting it like with the work that you're doing actively with technology and physically incorporating movement to develop neurotransmitters and all of the interconnected of all of that. So that seems like a very wholesome theme throughout the work that you do.
So Siri is the inspiration, and that episode, how she improved from that state where she was dependent on medications the medications were causing her to have side effects, and the side effects were worse than the treatment. But all that thing flipped with exercise, with intense exercise. And so that was the inspiration behind Sirica Therapeutics. And then another big jump happened. About 3 years ago, maybe 4, we discovered a method where she could communicate. And this is using a letterboard, an alphabet board, where she would point to letters to make words. And this method has been available for many years. We tried it once, it didn't work. And so we tried it again. This time it clicked, where she's able to talk through the letters, through making words, making sentences, making paragraphs. But it needs a very specialized coach who are trained in this method on how to do that. And then what we realized was that she is so smart and she has so much knowledge that is already in there. And she's just coming out with all of these things. And she told me she wants to become a neuroscientist.
So exciting.
It's amazing.
And so imagine my surprise and shock that, oh my God, she had all this knowledge and she can talk about things. She can talk about neurology. She can talk about science. She can talk about subjects that I never thought she was absorbing all these years, but she was not able to speak. And so that was a big jump that happened within 3 years with zero academic education throughout her life. Zero in the sense, maybe kindergarten level, maybe first grade level. But now she's attending college.
Wow, that's so exciting.
And she is an honor roll student in College of San Mateo, which is a community college. So she is taking all the prerequisites and getting A's.
That's amazing.
And so now I'm thinking, okay, how do we teach her all these subjects to become a neuroscientist? You know, I cannot, and she learns in this specific method with the letterboard. And so we said, okay, we need a machine or an app that can, number one, create these lessons for her on whatever topic she wants, right? So that she can learn using this alphabet board method, letterboard method. And so that was the first step. I said, okay, let me try this, LLMs, and tested different things. And I realized that, wow, this is great. And she started suggesting topics for her to learn. And then I started creating these lessons. And then I realized that there are at least a couple of million people in the USA that cannot speak. And we don't know how many of them have perfect, brilliant brains because they cannot speak. And they are considered low IQ people. Even Sirica was considered a low IQ person because she could not speak and she cannot sign, she cannot type, she cannot do anything. And so they are being, ignored in another sense. So I create with my co-founder, we created this application to build lessons for people that need this kind of education. And that's what Sirica AI is. Sirica AI, it generates these lessons depending on what grade level, how many paragraphs, what topic, what kind of questions, all of those things, keywords. And so that's our foray into how can we take AI and help individuals with autism learn new topic, new subjects, because there's nothing out there like that can help them with, because some of these kids have very high intelligence and they want to go deep into a subject. So I cannot open a neurology textbook. I mean, I can open and teach her, but it has to be in a method where she can understand and she can show that she's able to understand, right? So how do I translate that book medicine into this app medicine that she can learn? And again, she is my inspiration to come up with this idea on how to educate these kids using AI as a tool to bring that knowledge to them, make it accessible to a lot of special needs and autistic children.
Dr. Yuli, that's super exciting. And I think it's just even the first layer of what this can go out and be, because everybody learns differently.
Right. So then talking about this success and this
In fact, that's the first line we wrote on our website. Everybody learns differently.
that's good. So in terms
What
of
were you saying, Jorge?
I was gonna say in terms of these new discoveries and these new successes that you're coming along with, which are amazing. And as someone running both a startup and an innovation platform, what do you see as the hardest part of scaling healthcare solutions?
Healthcare is a tough industry. It is, number one, it is big, it is complex. There are a lot of regulations that were designed for a world in the last century. The world is changing very fast. So healthcare is not able to grasp or push innovation because of all these things that hold it down. Plus, there are a lot of legacy players, you know, that don't have an incentive to innovate. And that is the challenge. And the business model of healthcare is stuck also in the last century. Because that business model will not work because it causes more cost, poor quality, poor access, and less satisfaction for physicians and patients. And that is the status or state of healthcare business today. And that's why it is the last industry that will ever modernize itself or digitize itself. So it has a lot of legacy baggage that it is hard for current systems to jump into healthcare. If you think about it, there are only two pieces or two people that are most important in healthcare. Number one, the patient. Number two, the provider or the physician, and nurses and all those other people that provide healthcare. So this patient and physician or provider interaction is where healthcare, the basis of healthcare is. Everything else, all the hospitals, the pharmaceuticals, the pharmacies, the labs, the insurance companies, everything else is there to support this. But when all these other things become a huge burden on this relationship, physician-patient relationship, then the whole thing will deteriorate. Now, the beauty of AI is that it can strengthen this relationship. And if you can strengthen this relationship, you can also think about new business models that do not involve all this legacy baggage that you already have, because you can build a new model using AI, new business model, new healthcare model. And that is my main mission, to figure out how to do that and support the people that are doing that.
So in that end, so how have you driven your platform to get more qualified leads in your practice?
So right now, I mean, we do the usual SEOs and all of those things. We have some tools. And as far as Sirica AI is concerned, it's brand new. It is AI first platform. And so we just started, and we'll be looking at a lot of AI tools to drive that adoption in the future.
And what are you struggling with the most? Like, what will be your top 3 struggles at the moment?
The main thing is, how do we bring awareness to what we are doing? Because there are millions of people that have these challenges, and they are struggling, and they are, they don't have the time to go out and look for solutions. But we are building these solutions so that they can, their pressure because of having a child with special needs can be decreased. Their demand can be decreased. Their anxiety can be decreased. So we want to build solutions that can improve the lives of the people that are affected by autism. Autism is a very, very challenging condition to have in a family.
Yeah.
Families with autism have much higher divorce rate. They have much higher chances of financial ruin. They have much higher chances of these autistic people ending up as homeless or ending up as in the criminal system, because they cannot say that they're autistic, and then those behaviors to regular people appear as if they're bad. And so they end up, in bad situations. Their health outcomes are worse because of their inability to communicate, inability to socialize, will shrink their world to their room, which
Right.
means they don't have any physical activity. They become couch potatoes, and that obesity is huge problem. Seizures is a huge problem. Unable to communicate is what that creates that kind of a situation. And then aggressive behaviors is a major problem. And that's why they cannot go out in the community. And so all of these kind of spiral into bad outcomes. They live shorter lives, not because the autism is making them live shorter, but because of all these other things that affect their social health, their mental health, and eventually it'll come down to their physical health. And so they will have shorter lifespans because there is increased health risks of being sedentary in their own room.
Right. Let me ask you, with everything that you've shared up to this moment in regards to all the different projects that you are leading, all the information that it takes to go ahead and propel these innovative projects forward, what do you feel if we were to take a step back a couple of years when you first took on these endeavors, would you have a different approach? And if you would, on how to build and scale this accessibility for families and individuals, what would you do differently?
I think we are living in the best moment in the history of innovation because we have all these tools available and easily available, and the speed with which we can build. My co-founder Raj was saying that this same job would have taken 2 months, and now I'm able to do it in 1 week. That is the big difference. And you're able to build these things very fast and be able to test to see if that is the right thing and then iterate. And so you can do that at much less cost and much less human effort. And so that is the big, big advantage for startups and people who are innovating, is how AI is being able to help. And also, I think the way people think about AI is also changing. As they see these benefits, then we can go deeper and deeper into this technology and make human life better. There's a lot of things that we can do better, whether it is analyzing the diseases, predicting outcomes, and actually finding solutions to prevent bad outcomes. It's
Right.
always better to prevent a heart attack than to treat it, right?
Right.
And so that kind of bad outcomes, whether it is heart attacks, strokes, cancers, all of those things will be prevented, which means the cost will come down and the quality of life gets better. And
Gets
that's the most exciting part of living in these times.
Right.
That's the focus of my book, Punish the Machine. By the way, that was the first book that was published about artificial intelligence and how it's going to change healthcare and what the potential is.
That's amazing. A huge congratulations, because
Yeah.
I'm sure there's a lot of resistance, could be the word, when it comes to, as you've said,
Yes.
legacy and just shifting into the AI space. So that's
Yeah.
that's a bold foot forward.
Yes. And I'm excited about it.
Awesome.
Let me ask you, I wanted to ask in regards to the hold on. Let me recenter my question. My apologies.
No problem.
I do have one more question for you, and I'm very curious on when you are moving forward with the endeavors, and what qualities do you look for in the founders or the people that you surround yourself with? What are the qualities that you look for your team members to go ahead and bring these endeavors forward?
Good question. The first is obviously, you need smart people, number one. Number two, people with humility enough that they want to learn, right? They want to learn and get better and do better. And the third is so smart, humble, and people who have a grit.
I love that.
Those are the three qualities that I look for. And there's no stopping these people. Once they buy into the vision of what is possible, they will do unbelievable things.
It has been truly such a pleasure to hear your endeavors, hear the work that you're doing. It is completely pivotal for the time that we are living. And truly, I thank you so much for the work that you do. We thank you because we need this in the world. Everyone learns differently. Everyone needs resources and accessibility. And like you said, it's not quantity, it's quality. And this is the source. So Dr. Yuli, thank you so much for taking the time for sitting with us today, for sharing your story and your endeavors.